Have you noticed the sudden explosion of what people are calling Ozempic face? You know, that rapid weight loss that's leaving people with hollow, deflated cheeks? Well, it's actually acting as the catalyst for a massive shift in medical aesthetics. For a long time, the solution for facial deflation was just pumping the face full of passive gels. Honestly, it was essentially like taking a flat pillow and stuffing it with cotton. Sure, it puffs things up for a bit, but eventually it just flattens right back out. But the industry is shifting, and today we're looking at some fascinating clinical data behind a product driving this revolution. In this explainer, we're going to explore RevoShap StimuHA from Ipsoderma, Canada. It's a dual-action hybrid filler designed for complete structural regeneration, and it's a real game-changer.
Here's our roadmap for today's explainer. We'll cover the end of passive fillers, the shift to the hybrid matrix, biohacking with oligo-HA, lifting power, safety, and finally, what this all means for the future of aesthetics. Let's dive right in.
Section 1. The end of passive fillers, beyond stuffing the pillow. It's absolutely crucial to understand the fundamental problem with the old guard of the industry. For years, the aesthetic industry relied almost entirely on passive hyaluronic acid gels. Basically, they were purely mechanical space fillers to fix complex facial deflation, where you've got bone resorption, fat loss, and dermal thinning all happening at the exact same time. Clinics used to force patients through these complex layering protocols. This legacy approach required multiple syringes of varying stiffness. They'd use a firm gel deep down for the bone and a softer one closer to the surface for skin hydration. And what did that mean for the patient? A grueling 45-minute procedure with more needle changes, more poking, and significantly more trauma. On the flip side, the industry is now shifting toward active biological regeneration, where the goal isn't just mechanical displacement, but actual tissue replacement to rebuild the skin's structural integrity from the foundation up. Moving on to Section 2. Enter the hybrid matrix, the one-syringe solution.
What's happening now is that the industry is completely collapsing those separate silos of volumization and skin hydration into a single unified technology. In standard layering protocols, you might pair Voluma for lift with SkinVive for hydration, or maybe you'd pair Restylane Lift with Vital. Both of those require at least 2 syringes and over 45 minutes of clinician time just to treat one single area. But RevoShap StimuHA functions as a dual-action hybrid dermal filler. It literally provides the immediate structural lift of a high-performance volumizer and the deep biological benefits of a skin booster, all unified in a single syringe. That cuts the procedure time down to just 20 minutes.
And you can really see the true hybrid advantage when you look at the clinical results. Instead of just looking at the weakened structure of aging skin, consider the biological process immediately after injection. You get that immediate volume support pushing up the dermis, but more importantly, a bioscaffold is created. It isn't just sitting there inertly, it's actively maintaining structural integrity from within by stimulating your very own cells.
Section 3. Biohacking with oligo-HA, cellular command.
So you might be wondering, how can an inert blob of gel actually tell a human cell to grow new tissue? I mean, it sounds like science fiction, right? But the secret lies in something called the CD44 paradigm. The exact mechanism of action relies on free, uncross-linked oligo-HA fragments. These things are incredibly small, less than 10 kilodaltons in weight. You can think of these fragments as literal biological keys. They physically dock onto specific CD44 receptors located on the surface of your dermal fibroblasts. Those are the cells responsible for building your skin's structural matrix. Once docked, they trigger direct endogenous tissue regeneration, sending a chemical signal right into the cell's nucleus, actively commanding it to build living tissue. No way, right? But it's true. And the clinical biopsy results from the Paris 2025 trial proving this are just staggering. This direct fibroblast activation triggers a massive 34% increase in new type 1 collagen and a 22% increase in elastin fiber organization. Traditional fillers, they only cause a tiny bit of collagen production through mechanical stretching. RevoShap triggers true neocollagenesis. It is literally biohacking the face to replace the gel with your own living tissue as the product naturally dissolves over a 24-month period. All right, Section 4, lifting power and G', the foundation.
Let's look at how this builds the actual physical foundation. Because to mimic actual bone structure in the jawline, chin, or cheeks, you need immense lifting capacity, which is known in physics as elasticity, or G'.
RevoShap StimuHA boasts a staggering elasticity G' of 425 pascals. That is currently the highest lifting capacity on the market for achieving that sharp, localized lift. When a clinician is trying to rebuild a jawline or restore lost cheekbones, they absolutely need a high-density matrix that stays exactly where they put it, providing bone-mimicking projection without spreading all over the place.
When put head-to-head with traditional competitors, RevoShap absolutely dominates the field. It sits at the top tier with 425 pascals, compared to standard firm fillers like Restylane Lift at 385, or softer volumizers like Juvederm Beluma way down at 197. Now, a softer filler is fine for some areas, but for structural support, a low G' means the gel will likely pancake out under the skin over time. RevoShap's 425 G' ensures the initial lift is both effective and incredibly durable. And here's why this matters for the everyday person. Nobody wants a cheek filler that drops or a jawline filler that loses its sharpness after a month.
Which brings us to Section 5, Safety and Reversibility, the HA Safety Net.
The crucial question here is, if we're permanently stimulating tissue growth and using such a rigid, high-lifting gel, how does this compare to traditional biostimulators when it comes to patient safety? You might have heard of semi-permanent biostimulators made of calcium hydroxylapatite, or CHA, and poly-L-lactic acid, or PLLA. While they definitely stimulate collagen, they rely on permanent mechanical stretching or non-reversible inflammatory responses to get the job done. RevoShap, on the other hand, operates via that direct biological activation we talked about earlier. It works beautifully with the body's chemistry, not against it.
And this is a massive differentiator for both clinicians and patients, making it super important for search context as well. Because it's a hyaluronic acid hybrid, RevoShap is 100% reversible with an enzyme called hyaluronidase. If a rare complication like a vascular occlusion occurs, or honestly if the patient just doesn't like the result, it can be instantly dissolved. There is virtually no risk of permanent inflammatory nodules. It gives you the powerful regenerative benefits of a biostimulator combined with the absolute safety net of a standard HA filler. For anyone on the fence about regenerative aesthetics, having an undo button is a complete game changer.
Finally, Section 6, the future of aesthetics, regeneration and ROI.
We've talked a lot about the science, but this technology is also completely rewriting the business economics and daily throughput of aesthetic clinics across the globe. By eliminating the old split technology flaw, this unified matrix is a massive win-win for everyone involved. For the patient, it delivers a clinically proven 94% volumetric retention rate at 12 months. But for the clinic, it slashes procedure time from 45 minutes down to just 20. That means a clinician can comfortably double their daily patient throughput. And instead of managing a chaotic inventory of different filler stiffness levels, they just stock a single, unified SKU. It creates an unmatched return on investment for the practice while delivering superior, far less traumatic results for the patient.
And this leaves us with an incredibly provocative question to wrap things up. If we can biohack dermal fibroblasts today with a single syringe of a cosmetic facial gel, if we can actively command our own human cells to grow new tissue to replace a dissolving matrix, what does this mean for the future of every other medical implant in the human body? How long until joint replacements, stents, or pacemakers stop being inert objects and start actively dictating cellular regeneration from the inside out? It's a truly fascinating thought, and it all starts right here with structural regeneration. Thanks for joining me on this explainer. I'll see you in the next one.